A huge craze nowadays for PRP. Doctor, I've lost my hair. Let's do some PRP. I want to get my hair back. There's a lot of advertisement. People don't know what is PRP, but the rush is on because it has been wrongly advertised to grow new hair. Let me tell you something initially before I inform you of anything else. PRP does not grow new hair. PRP has no role in growing new hair. PRP improves the quality of the existing hair, makes them better, makes them stronger, grow better, better diameter, less falling, healthier, but does not grow new hair. What is PRP? PRP is called platelet-rich plasma. We take your blood. The blood has a couple of sections. One is the red blood cell and white blood cell, and the other is the plasma with the platelets. This platelet-rich plasma is known as PRP. What is done is blood is taken, about 20 cc of blood, centrifuged, sectioned, the blood cells are removed, and that extra plasma with the platelet-rich plasma, which has a lot of growth factors, injected into the area where you want better healing or treatment, and that is PRP. It's very important that the PRP is also prepared in the right way. Going to any clinic, there are a number of clinics nowadays which are basically cosmetic clinics. They don't have doctors, or they have employed homeopaths or Ayurveds or dentists. You don't know who is the person who you're talking to unless you check his qualification, and they never give you a prescription with the qualification, who really the doctor is. And if not done properly, PRP will not give good results. Different categories are there. You have to spin the blood taken for about 28-30 minutes and then suction out the PRP nicely and inject it by syringes. Another thing, some people come and complain, PRP is so painful. Doctor, it was so bad. The reason is the clinic where you've gone does not know how to correctly do the PRP. Ideally, in PRP, you can use some numbing creams, but these creams have limitations and don't numb everything fully. Or what we do, like when we do a hair transplant, numb the scalp. Some injections in the fore and the back, the whole area is numb. Only the injections at the time is painful, but then once you do the PRP, which is so many injections, maybe 50, 60, 80, 100, there is no pain whatsoever. After a PRP, you should not shampoo for a couple of days and do not use minoxidil. The rest everything is fine. You can go back to work the same day. Many people ask, should I do a PRP regularly after a hair transplant? Not required at all. In fact, I give it an option to my patients. I don't recommend PRP to anybody unless the patient insists that I want to do a PRP, because people do not know the real thing. PRP does not grow new hair. If you are using medicines, that itself is good enough. If you do PRP, the ideal way of doing it is repeat a session once every 4 to 6 weeks, 3 to 6 times, and then maybe after 2 years you can repeat a cycle once again. So let me finish off by saying PRP improves the quality of the existing hair, makes them better, makes them stronger, but does not grow new hair. If someone tells you that your baldness can be cured by PRP, it is incorrect. Please don't listen to that. Find out the truth and you will know what exactly is going to help you.